Today we are going to discuss a little bit of a controversial topic, nicotine. When people hear nicotine, they oftentimes associate it with cigarettes and the harmful side effects of cigarettes. But what I want to talk about is the many studies that have been done on nicotine and the potential health benefits when it's being used in its pure form and at controlled low doses. It has gotten a bad rap due to its connection with cigarettes. Remember, there are loads of chemicals added to cigarettes. We are talking about nicotine in its pure form in a very low dose. We are going to discuss the top 10 potential health benefits of pure nicotine, but before I get started on that, first I want to talk about where does nicotine come from. Nicotine is a naturally occurring chemical found primarily in plants of the, I want to make sure I say this correct, the Solanaceae family, which is better known as the nightshade family. So here is a breakdown of where nicotine originates. Tobacco plants. This is the primary source. Tobacco plants are the most well-known and concentrated source of nicotine. Other plants in the nightshade family where nicotine is also found is tomatoes, potatoes, eggplants, and green peppers. You also have medicinal and therapeutic nicotine. For medical applications, such as nicotine patches, gums, and inhalers, nicotine is extracted and purified from tobacco plants or produced synthetically. Nicotine's purpose in plants is pretty unbelievable. It is actually synthesized in the roots and then transported to the leaves. It acts as a natural insecticide, protecting the plant from pests. Now we are going to look at the top 10 health benefits of nicotine, and I can promise you that some of these are going to shock you. Number 1, cognitive enhancement. The benefits are that nicotine stimulates receptors in your brain that actually improve attention, memory, and learning. The studies suggest that nicotine may enhance focus and short-term memory, especially in individuals with cognitive impairments. Number 2, it provides neuroprotection. Nicotine may protect neurons from degeneration. Research shows promise in reducing the risk of progression of neurodegenerative diseases like Alzheimer's and Parkinson's. Number 3, treatment for Parkinson's disease. Nicotine stimulation of dopamine release can help reduce motor symptoms associated with Parkinson's. Long-term smokers who actually have consumed nicotine have shown lower incidences of Parkinson's disease, possibly due to nicotine's protective effects. Number 4, weight management. Nicotine is an appetite suppressant and may slightly increase your metabolic rate. Controlled nicotine administration could aid weight control without the harmful effects of smoking. Number 5, ADHD symptom management. Nicotine enhances dopamine and norepinephrine release, which can help improve focus and attention. Studies have suggested that it may benefit individuals with ADHD by improving their cognitive performance. Number 6 is mood regulation. Nicotine has mild antidepressant effects by modulating dopamine and serotonin systems. It may help alleviate symptoms of depression or anxiety in certain individuals. Number 7, potential for schizophrenia. Nicotine can improve sensory gating and cognitive deficits often seen in schizophrenia. Many individuals with schizophrenia use nicotine, and studies suggest it may alleviate some of its symptoms. Number 8, anti-inflammatory properties. Nicotine has shown potential in reducing inflammation in certain conditions, including autoimmune diseases. Crohn's disease and ulcerative colitis have shown improvements with controlled nicotine use. Number 9, pain management. It could be considered as an adjunct for managing chronic pain in certain contexts. Number 10, enhances physical performance. Nicotine may improve reaction time, endurance, and strength by stimulating the central nervous system. Some athletes use nicotine gum or patches for these effects. Add on a number 11 bonus. Last but not least, you may have heard that many doctors have been treating patients with nicotine patches who are battling symptoms related to long COVID. Many are seeing success with this. I myself am not a doctor, but I would encourage you, if you are still struggling with long COVID, to do your research. There are many videos related to this topic. While pure nicotine shows potential therapeutic benefits, I also just want to remind you to always talk to your doctor before trying any of these. Do your own research, and don't forget to like and subscribe this video if you found any of these tips helpful.